is published. So, as most of you know, there have been some changes to the diagnosis of PTSD, including in Criterion A, definition of a trauma. A lot of this will look familiar, right? So being exposed to death or threatened death, actual or threatened serious injury. The old criteria had the wording of a, what was it? A threat to oneself. Whereas this one actually is a little more explicit, and it says, actual or threatened sexual violation, which is what we used to classify those sorts of things like child sexual abuse. So that wording is new there. We also have a little bit of a difference with the way that we're talking about how the person has experienced the event. So they can either experience it themselves, they can witness it in person as it occurs to others, they can learn that it has occurred to someone close to them, and again we see a little bit of a difference here that the actual or threatened death must have been violent or accidental. And then this new way, really, of experiencing things, which is being exposed to aversive details of events repeatedly. So these are for people who are, maybe collecting human remains, emergency responders, those sorts of things. So this is, again, something new for the PTSD diagnosis for DSM-V. We also, are looking at some differences in some of the actual symptoms. A lot of what they're calling intrusion symptoms now, that we're experiencing symptoms, as we can see, are the same, right? There's a little bit of differences in wording, to be a little bit more specific. So we want to have at least one of these symptoms in order to get a diagnosis of PTSD. So we're looking at spontaneous or cued, recurrent, involuntary, intrusive, distressing memories of the traumatic event. See how this is a lot more specific than before. Recurrent distressing dreams. Again, we're specifying that the content can be the same as the trauma, but doesn't have to be. The affect can be the same. So the idea of fear, right? So we're being more specific in what we can include in these kinds of dreams, which we've been including, but now we know with DSM-V that we can include those sorts of dreams. Dissociative reactions, like flashbacks, where the person feels like the trauma is actually reoccurring. Intense psychological distress at exposure to internal and external cues that symbolize or resemble an aspect of the trauma. Right? Again, a lot more specific wording. And marked physiological reactions to reminders of the traumatic event. So these criteria are all the same, but a little bit more specific in how we're wording it. If we move to Criterion C, right, see that there are a lot less symptoms here than we used to have in the avoidance cluster. Again, we need one symptom here. And what is happening with DSM-V is that we're separating them out. So we're actually going to have an extra cluster of symptoms that a lot of the avoidance, what used to be in the avoidance section, will be, as we'll see. So there's only two avoidance symptoms now. Avoidance of internal reminders like thoughts, feelings, physical sensations that make the person think about the trauma, and avoidance of external reminders, people, places, conversations, activities, objects, situations that make the person think about the trauma. So we just have these two avoidance criteria, and again, one of them needs to be met in order for a diagnosis of PTSD. For Criterion D, this is where we're seeing a lot of new things and a lot of the symptoms that used to be in the avoidance section. Now for this, we may be looking at needing 3 symptoms, we may be looking at needing 2 symptoms. It's unclear at this point. I think the original proposed diagnostic criteria had 3, but there has been a study that says that 2 symptoms is just as specific just as sensitive, and a little bit less specific, so there's a little bit of a push and pull there. So not actually sure if it's going to be 2 or 3 symptoms needed here. But again, we see, the idea of not being able to remember important aspects of the traumatic event. So this is that idea of dissociative amnesia. And then we see a few new things. So we see persistent and exaggerated negative expectations about oneself, others, or the world. These are those negative thoughts and beliefs that develop after a person experiences a trauma that can develop. Persistent distorted blame of oneself or other people about the cause or the consequences of the event. So thinking that it's their fault or somebody else's fault when it really isn't, right? So that's that distorted blame. Pervasive negative emotional states. So these are things that, and we're going to go through all of these in more detail as we go through the actual items on the PSSI-5. These are these kinds of, fear, anger, guilt, shame that are pervasive, not just cued by trauma reminders, right, but are sort of long-lasting types of feelings. And then again, some of the familiar things, diminished interest in activities, feelings of detachment or estrangement from others, and inability to experience positive emotions, and numbing, those sorts of symptoms. So that's the cognition and mood symptoms, that new cluster that we have. And then we have Criterion E. So these are arousal and reactivity symptoms. We have this idea of irritability, right? Again, being more specific, we're talking about behavior here. So irritable or aggressive behavior, acting out in some way. The new criteria of reckless or self-destructive behavior. Again, we'll talk more specifically, but these could be things like drinking, starting to drink more, use drugs, sexual promiscuity, things like that. Hypervigilance, exaggerated startle response, having difficulty concentrating, and difficulty with sleep. Okay. Another new addition to the DSM-V criteria is we're no longer making a distinction between acute and chronic PTSD. For a diagnosis of PTSD, we're just looking at a duration of more than 1 month. And then we have the same criterion for the idea of interference. It has to cause considerable distress and interfere. And they're not due to, these symptoms aren't due to any other medical condition or something